I want to share a case to show you how much valuable information you could be missing out on if you don't look for the rehab insights in the brain imaging. This is a case of a lady in her 60s who was admitted to hospital for medical reasons. She had no neurological symptoms. But one day, the nurses have noticed that something had changed. All of a sudden, she didn't seem to understand instructions. When she was given a drink with a straw, she started chewing on the straw. She wasn't moving easily in and out of bed, in and out of the chair, and when she was walking, she was bumping into things. The nurses spoke with the doctors, and the doctors ordered a CT scan. The CT scan had a radiology report, and the radiology report said that there was no particular pathology identified. The nurses then asked for a senior physio to assess this lady. The physio found that it was really hard to work with this lady. It wasn't possible to assess her or to figure out what was going on. So she asked me to look at the brain images. When I looked at the brain images, within minutes I could see what could be a lesion. But more so, the location of the lesion explained exactly why we were seeing the clinical presentation we were seeing. In fact, I was able to then suggest an approach for the assessment and treatment, and also to make a comment about the good potential for recovery that this lady has. Later on, a neuropsychologist who was present in this conversation said to me that because of the conversation, she was able to take better suited assessment tools to assess this person the first time she saw her. So what was it that I saw in the brain images? I saw subtle changes in the brain area outlined in this picture. It meant that the patient or client had issues with processing visual information, so information that comes from her eyes. She also had problems understanding the spoken language because she's likely to have receptive aphasia. She had problem with planning or doing movements, especially when it had to do with objects, because she had ideational apraxia. Now, clinical assessment for each one of those conditions would have taken hours if you could assess at all. But with the brain images, I could have these insights in minutes. A second radiology report confirmed my suspicion, and it diagnosed an ischemic stroke. This case shows us the value of brain imaging. If you are a clinician, stop wasting your and your patient's valuable time. Stop second-guessing yourself. Stop spending time in lengthy assessments. Use guidance from brain imaging so that your assessment and treatment is more targeted, so that you can advocate better for your patients. Don't wait any longer. Start educating yourself in brain imaging. If you're a patient or a clinician, seek brain imaging trained clinicians and ask them to show you the images. Ask them to explain what it means. This way you can make sure that your rehab is even more personalized. For more information about brain imaging courses and consultations, head to my website. And if you like this video, please like, subscribe and share.